we always refer to when the first hospice was established in our country, but we understand that this approach was even here before that, for sure. And we know that with Dr. Anne Merriman, God bless her soul, she passed on recently, with the establishment of Hospice Africa Uganda in 1993, that's when we start to sound more on the approach to relieve pain and suffering. I want to make 2 points very strongly, and then I'll not say much. One, palliative care as an approach is not only for cancer. For the media who are here, you will appreciate that in Uganda, whenever we speak about palliative care, now that we are working with the Uganda Cancer Institute, it is always related and linked to cancer only. When you look at our website and see most of the documents that we have issued, and also the WHO definition and work on palliative care is an approach that relieves pain and suffering among people who have life-limiting illnesses. And life-limiting illnesses are not restricted only cancer. But for today, as you'll be hearing, we have a conference which is palliative care and also focusing on cancer. So the amount of work and research and data and information that you will find at our conference will be beyond. It will touch cardiovascular diseases, of course it will touch cancer, it will touch chronic respiratory diseases, it will touch HIV and AIDS, it will touch diabetes, it will touch sickle cell, it will touch aging, it will touch survivorship, it will touch real life stories of people who are in the community who are spending money on long-term care within our country and within the East African region and beyond. The second key point I wanted to make is that palliative care as an approach, and I know the speakers will expound on that and emphasize for you, does not only touch the patient, but also their caregiver and also their family. So when you come to our conference, you'll hear and you'll see people speaking and bringing you evidence and research, not only from the work they do with patients, I mean palliative care providers, who will be speaking and sharing their abstract presentations, but also what they do with the rest of the families and their patients. I want to thank you for the opportunity once again, and we look forward to interacting with you in more detail after the main launch. We invite you as the Palliative Care Association of Uganda to join us on 10th, 11th, and 12th at the 5th Uganda Conference, which marks 8 years of our Memorandum of Understanding as the Palliative Care Association of Uganda with the Uganda Cancer Institute, and which marks many years of conferences by the Palliative Care Association, because we have been holding conferences since 2003. I conclude by thanking again all our partners who are characterized this conference, and then also the working as far as the relationship between cancer and palliative care is concerned. As you had forged a very unique partnership between the Uganda Cancer Institute and the Palliative Care Association of Uganda. And this partnership has been mainly in on trying to see the common grounds that we have between these two areas, that is palliative care, and then of course the broader issue of cancer. And the best way we could actually harness this has been by making sure that we provide information, we create awareness, and also we make sure that our partners as well as our other members are well equipped with information. And this conference has actually been meeting exactly that need. And to have had it now going into the field, that means everyone has seen that actually there is value in holding these conferences. Of course, number one is to kind of come up with areas that are new, scientifically, socially,
educationally, and many, but focusing on answering the history of Olympic Games. So I believe and I strongly feel that this upcoming conference is even going to be much better than what we have had before. The reason is simple. We have had experience in the past, and all those experiences has actually been helping us kind of fine-tune our approach in as far as the areas are concerned. So I think we are going to be giving you a much better version of the conference come the 10th to the 12th for September this year. So